So my name is Alana Krober. I am the Director of Information Services here with United Way of Connecticut 211. And I'm here with my colleague Annie Scully, and I'm going to let Annie introduce herself, and then Annie's going to kind of recap sort of where this conversation started last meeting, so not last week's meeting, but the July meeting, and then we'll go through kind of a brief PowerPoint that kind of outlines some steps, next steps for the asset mapping, and then, we're in discussion mode, so keep your phones kind of muted so we don't hear background noise as we're going through it, but then at the end, we can take any questions. So I'll turn it over to Annie for a minute.
Thanks, Lana, and good afternoon, everybody. For those of you that were there, not this last meeting, but the meeting before, I'm sorry, this is repetitive, but for those that weren't, hopefully it will serve as sort of a quick recap and then a nice transition into sort of phase 2 of asset mapping, and really what we're going to do as far as using a tool to create an organized way to show the strengths and maybe gaps within your communities in terms of serving your older populations and your disabled adults. So an asset map really is a way to clearly depict community strengths and weaknesses. We talked about how it could be used to create a network of services, and that the tool of actually asset mapping is a really organized way of doing so, in listing resources as well as categorizing them into buckets, so that if you're trying to identify where a need is being met or whether a need is being met, you can quickly kind of draw that line. We sort of created a very simple tool. I don't know if you guys went over it at all last meeting. If not, we'll run through that in the presentation that's coming up. But really the goal of today's presentation is to take that next step and start organizing the assets that have been identified within our communities. So, like we said, asset mapping can help to identify those service gaps or the need for additional resources, but it can also really help to create an organized way of seeing what you have in your community and identifying those strengths and how you can make them even stronger. So I will turn it back over to Alana now to kind of jump into the next part of our presentation.
Great. Yeah, so, I think Annie did a nice job at the July meeting kind of setting the foundation for what an asset map is and why we do it, and then we've put together some steps now in terms of how to actually begin to go about doing that exercise. And so, just to kind of bring us all back to the objective of why this is, I think, part of these grants and why we're embarking on this exercise is, really the importance of inventorying sort of your resources has a number of different purposes, right? So to improve connection to services within your communities, to strengthen that service provider network, to identify potential partners, either MyPlaceBT Care Through Community partners or other types of partners, to pinpoint those strengths and gaps that Annie mentioned, and perhaps most importantly, right, to be able to make informed decisions and recommendations about future planning, future initiatives, resource allocation. Paul just chatted at us, a good reminder that we should have said at the beginning, which is that the webinar is being recorded today. So if you have colleagues or others who were not able to attend, we'll make the recording available. So we've kind of broken out the exercise of asset mapping into 5 kind of discrete steps. So the first step being to decide what categories of services to inventory. So, that's your starting place. Where are you going to start? Second step being the actual identification of those resources. The third step being how you're going to inventory the resources you identify. The fourth step being how to reconcile that inventory that you come up with, that you create with the 211 directory, with our database here that we maintain. And then the fifth step is really to determine action steps based on that inventory review and analysis. So we'll go through each of the steps. The first step, to decide what categories of services to inventory. So we can look at the same categories or buckets of services that are outlined on myplacebt.org. And that's kind of where most of us in our initial conversations with each other decided to start. So we, as a starting place, we said, well, let's look at the existing service categories that are already being highlighted on MyPlaceCT, right? Because those are already the ones that we've, the state has already kind of said these are important services to this population. So let's start there so that we're aligning ourselves with the myplaceCT.org website. And so those categories of services are meals and groceries, housing, social activities, transportation, in-home care, monitoring, informal caregiver support, veteran services, and legal. And then what I did is I went through the 211 database, right? So I went through the taxonomy terms that 211 is required to use to index all of our services in the 211 database, right? This is, most of you know, we've talked about this. The taxonomy system we use is a national one that all accredited 211s have to use. And so it's not always common language. It's not always intuitive. So I went through that and I picked out the handful of taxonomy terms that I felt like were most relevant to each of those categories. And that's kind of where we decided to start in terms of pulling services to inventory. And then above and beyond that, you could determine additional community-specific needs or focus areas that complement or are in addition to those initial categories. And you could determine those additional needs or focus areas based on a few different methods, right? So those might come out of community forums that you've already had or that you're planning to have, where particular issue areas or needs come up in the community forums that are not reflected in the categories on MyPlaceCT. It might come from looking at some of the community need data that's available on 211 Counts. And we've talked a little bit about 211 Counts in other meetings as well, but the URL, if you haven't visited, is ct.211counts.org. And that website is a dashboard of all of the 211 data from the last 3.5 years. And you can drill down to look at needs on a town-wide basis or a zip code basis, county basis.
Lana, can I stop you? It's getting really hard to hear you. Background noises from you, or if somebody else needs to mute, but it's getting hard to hear.
Okay, there's no background noise where I am. So if you guys are hearing background noise, it must be that somebody doesn't have their phone or their computer on mute. So those of you who are participating, if you could just double check, make sure your phone is on mute, or if you're listening through your computer or your computer speakers are on, if you can mute your computer mic as well. So please do so now so that everybody can hear a little bit better. Yeah, it sounds like somebody's still unmuted or their computer muted. If they could do that now, I'll just send a note too. Okay. And then the third way would be, to look at other data sets. So in the course of this exercise, you might also be looking at community health needs assessments that are available potentially for your area or your community. So hospitals are required to do community health needs assessments. So if you have a large hospital near or in your community, that might be an interesting data set or report to look at that might also illuminate some other areas of need that you want to focus on. But initially, we decided to start with the buckets of services that are outlined on MyPlaceCT. So moving on to step 2, which is to identify the resources. So this is where we're going to actually try and find those resources that exist in our communities that are part of the service categories that we identified that we're going to focus on initially. And again, there's several different ways to go about identifying those resources. The first way, and probably the most obvious way, is to look at the programs that are already listed in the 211 database. And so we can do that either by pulling a custom data file for you in an individual spreadsheet, or you can really bad background noise. Whoever does not have their phone muted, if you could please mute your phone or your computer.
You're saying Diane's done.
Yeah. Really bad. We're gonna pause for 1 second and see if there's a way we can force mute people. Can you guys still hear me? Okay, it looks like Diane says that she can hear me. Okay, so I think I muted you all or muted just one person. I'm not sure, but either way it seems to have worked. So we will continue. I apologize for that. So we are on step 2, talking about how to identify the resources. And so one potential way, like I said, is to look at the resources that are already listed in the 211 database for your community. And we can do that by pulling a file for you, so pulling an Excel spreadsheet for you, or by, you can play around on 211ct.org yourself and search for any category of service to get a sense for the services that are listed in your community. So for Newington and Enfield and Danbury, last week we did send you kind of those initial listings, those initial Excel sheets of the services within the categories initially outlined on myplacect.org, and we'll talk more about that in a second. And then there are other ways beyond the 211 database to find and review resources in your communities. So one would be to look at other resource directories that might exist. So sometimes there are directories that exist already on town websites, town social service departments, or other municipal departments sometimes keep their own inventories as well. Senior centers, we know, also have listings as well. Libraries sometimes maintain their own directories or informal lists of resources, because they are often in position to refer residents to services. And community health centers or clinics often have their own directories because they often also are in a position of trying to refer folks to resources. And local United Way sometimes as well. So, those are some potential groups to connect with to see if they have existing resource directories. And then, of course, the last way would be, to facilitate community meetings or focus groups where you're getting a cross-section of individuals from your community together, doing some brainstorming or mapping sessions to really get, pick people's brains to say, where are all of the, access points in our community where people are getting help with transportation, where they're getting food help, right? And just, having a session like that where people who are in a position to know those types of services can help identify maybe some informal resources that we don't have in 211, or don't exist in other directories. Okay. So this is a little bit what I was referring to before. So the initial 211 data file, that Excel sheet that I sent the 3 communities last week. These are the categories that we pulled from the 211 database. And then under each category, you'll see the actual taxonomy terms that we pulled from the 211 database. So again, not exhaustive. We didn't pull every possible term within each category. You would have had really long files. So we wanted to send you something sort of manageable to review and look at to begin with. However, as you're looking at it, if you decide there are additional services within any of those categories that you want to look at, just let me know, and it's easy enough for us to pull in additional service categories and send you a revised file. And so this is, a snapshot of what that file looks like that went to the 3 communities. Pretty simple. We didn't give you a ton of information. We gave you the taxonomy. We gave you the site name. We gave you the address of the resource, the program name, phone number. So, you have just a snapshot of the various resources. And then the third step is, after we've, you've done those various, gone through those various ways to identify the resources in the community, is really to inventory them. And so, we think probably starting simple is a good way to go. So it could be something as simple, right, as sheets of paper for each service category and sticky notes, right? So, and we've all done this type of exercise where you have a big piece of paper up on the wall for your meals category, one for your housing category, and literally as you're identifying various resources and programs, you're writing those program names on sticky notes and you're throwing them up on, on the sheets of paper of the category where they belong. Something as basic as that, and then, an Excel spreadsheet where you can a little bit more formally catalog and inventory the resources and what category they belong to, and then, do some sorting and some analysis down the road from that Excel sheet. And we'll take a look at the template that we came up with in a second. But, in any sort of inventory, whether, you're doing it on an Excel spreadsheet or some other, using some other tool, you want to include basic information in that inventory. So you want to include what the specific issue is. You want to include what that roll-up category or bucket is, what the specific asset is that you've identified. So what's, the program name, the location, the 211 directory status we think would be important for you to identify and track in your inventory so that is this a resource that already exists in the 211 database? Does it not exist in the 211 database? Does it exist in the 211 database but potentially, needs updating? And then you might also want to include additional information as well, and address, phone number, optional sort of notes for yourself. And then, if you want, and I think this is, kind of next level and not necessary for the initial exercise and to achieve the outcomes that you're hoping to achieve, you could take your spreadsheet and, get fancy if you wanted down the road and put that Excel sheet if you've kind of been intentional about the way that you've inventoried things, and throw it up on a map in Tableau, use Google Fusion tables or Google My Maps to create, an actual visual map of all those resources in your inventory. So this is kind of the basic template that Annie and I provided last week, as one example of a way that you could, just a pretty simple solution, and a simple starting point to inventorying those resources that you've identified from the 2-in-1 data file, from your other, directories that you've identified in your town, from your community forums and your focus groups, where you are, simply tracking the particular issue, the asset you've identified, that you're consistent about, the category of asset, right, so that you're tracking that so you can quickly sort or roll up and look at all the resources within a particular category, that you are tracking the 2-in-1 directory status, so saying, you can see here whether, the asset is listed in 2-in-1, listed but needs updating, or not listed, and then maybe, a column for notes. So if it's listed but needs updating, perhaps you have a little note here about, what needs to be updated in the 2-in-1 directory, or some other helpful notes for yourself, to help to aid you in your analysis as you're looking at your inventory. And then the fourth step, really, once you have, a solid, foundation to your inventory, is looking at that inventory of community resources and reconciling it with the 2-in-1 directory. So if you find resources, that are important to you, that are in your inventory, that are listed in the 2-in-1 database already, well, that's great. There's no further reconciliation or next steps that need to happen necessarily with those. However, if there are resources that are listed but you find they need updating, there's a couple different ways to go about handling those resources. So one would be to kind of, just track those in your Excel spreadsheet, make a note potentially of what the change is or what's outdated, and then at the end, when you have kind of a mostly complete list, you could send that entire spreadsheet to our information services department here, and we will handle making all of those updates. So you can kind of just ship it off to us and we'll take care of it all. Or you could ask the programs themselves, if you're having interaction and bidirectional communication with those services, you could ask them to submit their own updates to us using the electronic form on our website, and I included the link there for you to forward to any agencies who need to give us updates. And then lastly, there are resources that you may find that are not listed at all in the 2-in-1 directory. And again, you can email that spreadsheet with of all the ones that aren't listed to our information services department, and we will review all of those with the intent of trying to list as many of those programs as we possibly can in the 2-in-1 database, so that they can live there and be updated on a regular basis, and access via My Place and the 2-in-1 website. So we will review that list against our inclusion and exclusion criteria and list all the programs we possibly can. And then there would have to be a follow-up discussion kind of, with Paul and others about kind of, what we would do on a community by community basis for programs, if there are any programs that can't live in the 2-in-1 database because of our inclusion exclusion criteria. And then lastly, I would say, once that inventory is complete, reconcile with 211. So the 211 database is as complete a reflection of your community resources as possible. It's also then using that inventory to look for, your community strengths, gaps in resources, looking for opportunities for better coordination, identifying potential partners, thinking about strategic planning, resource allocation recommendations to the state and to others. And all of that, your community asset map can really be a great vehicle for doing all of that. So I'm going to pause there because that gets us through kind of the bulk of the content that we wanted to cover. I'm going to see if Annie has anything else to add to that, and then we'll be happy to take any questions or open it up for further discussion.
Thanks, Alana, and absolutely, I think we're eager to hear your questions and hope you have some feedback. But just to kind of reiterate to Alana's point, the most important step is really to get your assets in an organized way that makes sense to you and your communities, and to really map out that network so that you can, A, figure out ways to make it stronger, and B, identify any possible gaps or barriers that you need to overcome as a community, and on a larger scale to really make this network across the state as strong as possible. And I think the initial exercise of going through community conversations and using our 211 database to kind of compare and contrast the needs of the community with what we have available already as a database on 211 is a great starting point. And we hope this tool will help you guys do that, and then to further identify needs and areas that we can make 211 stronger, but also that your local network is as strong as possible.
Yeah, great. Thank you, Annie. So we are going to try and unmute your phones now, since I think we muted you all. That's going to take 1 second. Okay, so all of you who have dialed in by phone should be unmuted now. So if you have any questions or comments, please go ahead and unmute your own phones, and we're happy to open it up.
Diane, I don't have any questions. This is really helpful information, though, and I am looking forward to moving forward with it.
Great. Thanks, Diane, for the feedback. I'm glad it was helpful.
This is Paul. I had a couple of questions along the way, and you managed to answer every single one of them.
Oh, good.
Great to hear, Paul.
And, I have my contact information and Annie's contact information here, for a reason, which is really please don't hesitate to reach out to either of us directly, if as you continue down this road and, get more deeply into this exercise, if you're, have additional questions, or you run into stumbling blocks, or you want us to pull more data from the 211 database, just shoot us an email, and we will do the best we can to oblige.
Absolutely.
Any other questions, or oh, it looks like Julia is chatting in a question about oh, sorry, I muted Julia. I'm trying to unmute you, Julia. Okay, so Julia, you should be unmuted if you want to try and speak in your question.
Okay, can you hear me now? Can you hear me?
So it looks like Julia is asking about the interface between VA services. So between VA services and InfoLine. So we do our best to list the VA services in the 2-in-1 database. There are some services, that are some like health services where you kind of have to access them through a separate access point that we might not, that we may not list anymore. But mostly we should and we would want to have VA services listed in the database. So if in the course of your going through this process and doing your own community asset maps, if you identify VA services that are not listed in the 2-in-1 database that you know about, please let us know about those. And I don't think we pulled in all the VA services in the initial data files for the 3 communities. So if you want a more thorough look at VA services, let me know and we can rerun that particular tab for you on your Excel sheet to pull in some other veteran services. Okay. Yeah, and we can definitely do that for Newington if you guys want us to pull in some additional taxonomy terms related to veteran services. Okay. Any other comments or questions? All right, it doesn't sound like there is, so we will go ahead and close the webinar, and Paul, I will do my best to figure out a way to get you the recording so we can get that out.
Perfect.
All right. Thank you
so
all
much,
for joining us this afternoon. And we'll talk to you all soon. Take care.
Bye.
Bye.